special test for the knee, which is the anterior drawer test for anterior cruciate ligament (ACL). So, this is the anatomy of the injury. ACL is a major ligament in your knee that keeps your shin bone from sliding and gliding forward in relation to your thigh. An injury, such as a sprain to your ACL, may cause significant knee instability and prevent you from participating in high-level sport that require stopping and starting, running and jumping. The common injury that occurs is the anterior cruciate ligament, which is ACL. Next, we will talk about the mechanism of the injury. ACL injuries occur when bone of the leg twists in opposite direction under full body weight. ACL can be injured through the direct contact or collision, such as in a football tackle. This is the procedure of anterior drawer test. Make sure you are in supine position, lie on your back with your injured knee bent and your foot flat on the floor. Have your friend sit gently on your foot so it does not move. Have your friend grab your knee with her thumb in the front of your knee and her fingers behind your knee. Your friend's fingers should be tucked up into the bent part of your knee and her thumb should be on the front part of your upper shin. Then, have your friend gently pull your shin bone forward while watching how far it moves. Repeat the test on your healthy knee. After that, the do and don't during the test. This is what you need to do during the test. Try to avoid doing this during the test.
Alright, Bismillahirrahmanirrahim. Assalamualaikum. So today, pivot shift test for knee injury. So anatomy of knee joint. Alright, you can see in the diagram there's femur, patella, basic anatomy. So we go to the common injury that needs the pivot test. This is the diagram. This area. Alright. Okay, next is mechanism. ACL. Then the procedure, you can read it. Do and don't in this test. That's all. Thank you.
Next is the McMurray's test. It is used to determine the presence of a meniscal tear within the knee. The medial meniscus and lateral meniscus are crescent-shaped bands of thick, rubbery cartilage attached to the shin bone. They act as the major shock absorbers of the knee. The medial meniscus is located on the inside part of the knee joint, while the lateral meniscus is located on the outside part of the knee. The meniscus can be torn during activities that cause direct contact or pressure from a forced twist or rotation, a sudden pivot or turn, deep squatting or heavy lifting can all lead to the meniscal tears. Many people of all shapes and sizes are prone to having meniscal tears. Athletes are more at the risk of having meniscal tears due to the activities mentioned above. Athletes that play sports such as football, soccer, basketball, and tennis have this risk. If you have osteoarthritis, you're at higher risk of. The most common injury at the meniscus is the longitudinal, bucket handle, flap, transverse, or torn horn. Next is the procedure for the McMurray test. The patient lies supine on the bed with the hip and knee both flexed, with the foot as close to the hip possible. The clinician holds the knee joint with one hand and the other hand rotates the tibia internally and externally while extending and flexing the knee. If the test is positive, the patient will feel pain and the clinician will feel or hear the meniscal movement when the meniscus is compressed between the tibia and the femur. During the test, take note what to do and what not to do during the test. Good news, the McMurray test does not need any expensive equipment.
In this video, I would like to talk about the Lachman test. The Lachman test is a test that I will perform on the knee to identify the stability and integrity of the posterior cruciate ligament, which is PCL. So this is the patella, the head of the knee. Underneath have two fiber, which is ACL and PCL. Both of them have their own specific use in order to make the knee stay in its place. PCL is a ligament within the knee. Ligament is a tough bond that connect two bones. The function of the PCL and ACL is the same, which is connecting the thigh bone, femur, and the shin bone, tibia. Although it has a stronger and thicker bond, ligament, but posterior cruciate ligament, it is possible to be torn. The first one, we have to put our hand on this side and the other hand on this side. We must make both whole leg stable, and for the bigger thigh, we must do it correctly. The first step to assess the Lachman test is to make the leg stable. It is important to make the accurate measurement. First, we pull up the leg at 30 degrees. Our outer hand placed at the femur and the other hand at the tibia. Importantly, the thumb will place on the tibial tuberosity to make the measurement more accurate. This is to prevent further injury. These are the lists for do's to maintaining the health of the knee. First one is build muscle strength. Second, maintain a healthy weight. Last but not least, warm up and stretch. And we're moving to don'ts for the dealing with the injury. First is don't ignore pain. Second is don't rest too much. And last but not least, don't wear the wrong shoes.
Next, we are going to talk about the valgus stress test. This is for the MCL, the medial collateral ligament. The medial collateral ligament, the MCL, is located on the inner part or part of your knee, but it's outside the joint itself. Ligaments hold bones together and add stability and strength to a joint. The MCL connects to the top of the tibia, the shin bone, or the bottom of the femur, the thigh bone. The MCL is most commonly sprained from a direct blow to the outside of the knee. The MCL may also be injured with an excessive outward twist when the foot is planted on the ground. This is seen more commonly on surfaces that have increased friction, like artificial turf and courts. There are classifications of the injury. There are Grade 1, Grade 2, and Grade 3. Grade 1, the mild injury with minimally torn fibers and no loss of MCL integrity. Grade 2, moderate injury with an incomplete tear and increased laxity of the MCL. And lastly, Grade 3, severe injury with a complete tear and gross laxity of the MCL.
Barrow stress test is the special test for the lateral collateral ligament (LCL). So, this is the anatomy of the injury. The lateral collateral ligament is a thin band of tissue running along the outside of the knee. It connects the femur to the fibula, which is the small bone of the lower leg that runs down the side of the knee and connects to the ankle. The main function of LCL is to keep the knee stable. The common injury to occur is the lateral collateral ligament injury, which is LCL. Next, we will talk about the mechanism of the injury. Tears to the lateral collateral ligament most often occur from a direct blow to the inside of the knee. This can stretch the ligament on the outside of the knee too far and may cause them to tear. This type of injury occurs in sports that require a lot of quick stop and turn, such as soccer, or where there are violent collisions such as hockey or skiing. The ligament can also be injured by repeated stress that causes it to lose its normal elasticity. After this, we will talk about the procedure of the Barrow stress test. To conduct this test, make sure your patient is in supine lying position with the leg fully extended. To perform the test, instruct your patient to relax as much as possible. Grab on the lower leg with one hand just above the ankle joint and fixate with the other hand on medial side of the femur. Apply lateral rotation in the knee joint and perform passive adduction in the knee joint to put stress on the lateral collateral ligament. Consequently, perform the same test with the knee in 20 to 30 degrees of flexion. The do and don't during this test. This is what you need to do during the test. Try to avoid doing this during the test. Equipment needed for this test: only the roller that 10 to 20 cm.